Good evening, everyone. My name is Jerry Fauzan, and these are my team members, Azim, Hazim, AK, and Surya. And today we're gonna present to you the sports injuries that happens in football. So before we go to the injuries, let me explain to you what is football. So football is a world famous sport played by the majority of the people in the world. It is the most played sport in the world. So if you know about the FIFA World Cup, you may know that all countries from various places in the world compete against each other to earn the trophy, which is the most prized trophy amongst the football community. Football was originated from England in 19th century, but it wasn't an official sport. And it's not clear where the football originated from, because there was a lot of versions of football that was being played before the 19th century, which is the Chinese and the Greeks, where they kick a football, use the term football, but the rules and regulations were far different from what we know today. So it wasn't an official sport back then, because football was basically kids playing in the streets, and rules and regulations are very far off from, well, it's been evolved to what we know today. So that's all for the introductions. Let's move on to the injuries of football.
Hi, my name is Akeshwaran Kanagasingam, and I'm going to talk about the bruises that football players in professional and normal players who get injuries such as bruises. First of all, what are the signs and symptoms for bruises? Bruises are causes swelling and also check and the surface limit of the joint. When we have joints like this, our bone joints, when there is a contact with another footballer, because we do know that football is an aggressive game. Football, when players are running to tackle or something, of course there will be a collision between other players. So when there is collision, of course, if the collision is really very bad, the chances of the players, footballers to get bruises are very high. So that is what where it causes a swelling. Personally, me, I've played football many times, football and futsal. So common injuries that I get is swelling, which is first it gets red and then dark blue, and then it will become blue black fully. So that is what we call bruises. The treatments for this, of course, we can use the RICE treatment, which is rest, apply pressure using ice, compression, and also elevation. Not only that, prevention methods are to maintain and pain and a playing range, wear socks because it will become an absorbent, wear shin guards, which is very, very essential and important for the players to wear to protect their shin during the professional game. And last but not least, seek professional advice on footwear. If you look at the boots, there are lots of types of boots where they have different number of studs on the boots. Whenever we wear the suitable footwear for us, for the football players, that would be the great way for them to really perform well and not injuring themselves and injuring other players. That's all from me. Thank you.
So greetings to Sir Izzuddin and everybody else. My name is Suryakant and today I'll be explaining about torn ligaments. So in football, the most common torn ligament is the ACL injury. So what is the ACL injury? It is known as the anterior cruciate ligament. So let's see where it is placed. So the anterior cruciate ligament is placed in between your femur and in between your tibia, which is your thigh bone and your shin bone. So it acts as a strong band of tissues which attaches your shin bone and your thigh bone. It is very stretchable and elastic, allows you to turn your knee 360 degrees and everything, but sudden stress or sudden trauma to your knee, where you turn at a quick reaction time or suddenly, which will cause your ligament to tear. That's how torn ACLs happen. So this is how a torn ACL looks like. Okay. So ligament, what is ligament? Ligament is a band of tissues that connects your bone to your bone. So we must not get mistaken between a ligament and a tendon. A tendon is something that attaches your bone to your muscle. So signs and symptoms. So like I said, how an ACL injury happens in football context is something like this. Say there are two players standing opposite direction. One player is planning to tackle the other player. So this player feints his movement as to he's going to move to the left, but then he suddenly moves to the right. So this player gets tricked and he moves this way and he suddenly turns like this. So it goes from a 0 degrees to 180 degrees. So sudden movement or sudden stretching, sudden trauma to your knee like that will definitely cause your ACL to your ACL to tear. So upon your ACL tearing, what will happen is the athlete will feel a pop sound or feel a popping sensation in their knee, followed by tremendous pain. Okay. So when this happens, the player will be subbed out of the game to seek treatments. So during treatment, they can apply the RICE module as a temporary measure, which is resting, ice, compression, and elevate. So this is just to hold the player's pain or give the player attention before he receives proper medical attention at the hospital. So at the hospital, you will be assessed by a doctor, and the doctor will give you treatment and tell you how severe is your torn ACL. So most probably is rehabilitation, consulting a physician. Physician will give you exercises and help you to bring your knee to your previous condition, which is helping you to cure from your ACL injury or treat you from your ACL injury. So all this medical attention will probably take a time span of, depending on the player's healing rate, it will take a time span of definitely more than 3 months or 5 months, or if the player's healing rate is lower than that, it will take probably years. So definitely the player will be advised not to go into competitive sports or not to do strenuous exercises, nothing that puts too much pressure or too much intensity on our knee. So the last option, or another alternate option, is known as surgery. So surgery is an option to players or athletes who previously was at their peak form, but now due to ACL injury, they can't play like they used to. So surgery is another option where they will change your whole ligament. They'll take off your torn ligament and they will find another ligament from another part of your body, and then they will put it back at between your knee and your thigh bone. I mean your thigh bone and your shin bone. So that will be your new ligament and your new anterior cruciate ligament. But doesn't mean if they do surgery, your player's performance is going to come back to how they were, because ACL injuries tend to take a toll on players' performance and their knees functionality. So it all still depends on the player's mindset and the player's healing rate and how fast the player can return to their prime form or their peak performance despite doing surgery. Okay. So next is prevention. So what people can do to prevent from getting their ACL torn. So to prevent from getting the ACL torn, they can do knee exercises, leg workouts. All these helps to strengthen our legs, strengthen the muscles, build more muscles, and increase our healing abilities or healing rate. Followed by all these exercises in football context, they do something known as drills, agility drills, mobility drills, situational drills. Situational drill is something like putting you in a situation where you will have to face your opponent who plans to pivot or cut you, and you have to have proper strategies or techniques to how to tackle the player without getting your ACL torn or getting your knee twisted or putting you in a situation where it applies too much pressure on your knee and causing another ACL torn. So followed by all these exercises and drill comes nutrition. So nutrition and proper recovery is something which is very vital and very important for players or athletes, active athletes, because nutrition and proper recovery will increase the healing rate and decrease the risk of getting injured in every player or every athlete. So that's all for ACL injuries, and thank you.
Hello, my name is Muhammad Hazim bin Azhar, and I will be presenting the third injury for football, which is a concussion. Now, a concussion is an acute injury in which a player receives a very hard hit to the head, which knocks them unconscious. There are, however, circumstances where the player does not fall unconscious even when getting hit. Now, a concussion occurs when the head gets hit so hard that the brain inside shakes back and forth, resulting in the injury. Now, for signs and symptoms of a concussion, the player will appear dazed or stunned and receive a headache as well as dizziness. They will look confused, not knowing what to do, and they will forget what happens before and after they lose consciousness. With dizziness, they would lose their stability, being unable to walk properly, as well as getting massive headaches, which is painful for their heads. Now, these are the common symptoms to see if a player receives a concussion after getting hit. Now, for the treatments of a concussion, it's very simple. The best treatments for concussion is for the players to rest and avoid physical activity. By doing so, the recovery process will not be disturbed, and they can go play again after a while. It's best that they avoid any heavy activities so that they can properly recover. They can also do light head stretches. By doing so, they will also help fasten the recovery process. Now, for preventions, there are not many preventions for concussions because in football, players don't usually wear anything on their heads. Usually, at the very least, a goalkeeper will wear gloves and maybe a headgear, but only for goalkeepers. For players out on the field, they barely wear any gear. So the best preventions for concussion is to have the medical team looking out for the players. By doing so, they will be able to see any of the players' reactions to see if they are dazed or stunned, have headache, dizziness, so that the medical team can call for the players so that they can be removed from the field and rest immediately. It is also best for the players to be advised to be careful on the field, so that they would know to be careful when playing and not play too roughly, especially when they are going against other players. Because playing football can get really rough sometimes to the point that very fatal injuries can occur. And concussions can occur many times when they are playing with each other, especially when things are getting even more rough, when there are headings, or even when you're just bumping into each other. So that is for the concussions. And here are some few pictures. As you can see here, there's a picture of a concussion, the injury of the brain itself. And here is a person already knocked unconscious because of concussion and is now being carried out from the field. And here's the two players bumping into each other as well as trying to do a heading. And this can result in a very serious concussion and must be treated immediately. So maybe so that both players must be rested and avoid any physical activity. So that is all for my part for concussion. I will pass it to the next presenter. Thank you.
So the next injury is ankle sprain. Ankle sprain happens when you twist and bend your your foot in an awkward position. And when you twist it, the tissue or the ligaments will tear and there will be no support for the bones. The signs and symptoms for ankle sprain is you feel pain when you're walking, you feel tenderness in the affected area, and you will see bruising and swelling in your ankle. So treatments for ankle sprain is using REST protocol. The treatment is depending on the severity of the ankle sprain, but usually you just use REST protocol to treat the sprain. So RICE basically means rest, ice, compression, and elevated. Rest is you take a rest from doing any sort of activity that involves excessive movements. Ice is when you put ice pack on your affected area for 3 times a day for 20 minutes to reduce the swelling. Compression is when you bandage or dress your ankle that is affected, so that you can speeden the healing process. And then you have to elevate your foot higher above your heart level, so that you can stop the blood flow, or not stop. You can reduce the blood flow, so that the healing process will be hastened. And preventions how do you prevent ankle sprain? You have to do proper warm-ups. You have to, before do any activity, you have to relax your muscles so that they can be comfortable with excessive movements. Next is pay attention to the surface when running or jogging. You need to really pay attention for the surface of the ground when you're doing any sort of activity, because when there's uneven surface or a hole, you accidentally step in, it will cause ankle sprain and bend your foot in an awkward position. And wear suitable shoes, because if you wear shoes that are too tight, it will cause pressure on your ankle, and when you do excessive movements, then it will be easier for ankle sprain to happen. And lastly is wear ankle support, brace, or tape. This is when you have a weak ankle, or you might think that you are more prone to having ankle sprain. So these are the pictures of ankle sprain. If you can see to the left, the tissue is torn and there is no support for the bones. So ankle sprains have two versions, inversion and eversion. So for inversion, the lateral ligament is sprained, and for eversion, the medial ligament is sprained. Usually ankle sprains happens inversion. There are rare cases of eversion, but that still happens. And so that is all for the ankle sprains. Moving on to the next injury.
Assalamualaikum and a very good evening to all my fellow friends and lecturers at Management and Science University Shah Alam, Malaysia. I am Nur Azim bin Abdul Razak, and today I'm gonna present about calf injury in our course, Management of Sports Injury. Okay, gonna share screen. Okay, calf. Calf is the part of the lower limb or the back of the lower leg. Here is the most important area where all footballers must preserve in order to be fully fit during a season of football. Calf muscles consist of two main muscles, namely, which is the gastrocnemius and soleus, and also plantaris muscle here. And these muscles are vulnerable yet essential for a player to protect. The twisting motion and the sudden change of direction when players trying to reach the ball may tear up the connective tissue here of soleus or the plantaris tear, which is the long tissue. This is a fibrous tissue. And this ill effect condition may have different effects to different type of player who have bigger volume in muscle strength, the size of the circumference of the back of the lower leg, and also depending on their roles and function of the team, depending on their position at the football field. The more player, the more they run, the more susceptible they are to injury. Okay, this is a situation where a player will feel a sensation of a stabbing or a cutting, knife cutting at the back of their calf, muscle. Okay, moving on to signs and symptoms. When fatigue came creeping in during the penultimate time of the year, where all football players suffered from burnout condition, where players are restless and feel to exhaustion all year round, they might certainly be fragile and destined to be injured. First, they will feel a slight muscle stiffness or severe cramp, and then if they do not have ample time to rest, they will have they can feel like their leg will feel like a dead leg. It will be a cut. It will be feel like a knife stabbing or a cutting sensation feel. Okay. Moving on to treatments. Players won't be able to fully extend their legs and in dire need of a lengthy rest. Usually depending on its severity, player will have to rest to maybe in 13 to 28 days. Okay, using the same formulated method of RUSH, which stands for rest, ice, compression, and elevation, calf-related injury patient will have to go a series of projected and diagnostic tests to be back regularly playing week in and week out. Okay. At this stage, players will have to undergo MRI scanning to check whether the ill patient needs a major injury or just a minor one. This is for the club medical officer representative for future reference. Okay. Next, the injured player needs to regularly use the traditional ice pack or the modern cryo ice wrap machine or even ice bath for traditional use sporadically as a means of muscle relaxation, usually after game heading to the road of recovery. Okay, the next process is compression, which is the third step in the treatment program, which require elastic cohesive bandages in the common form of underwrap and rigid tape. The recommended is ACE bandage to maintain steady position of affected or injured muscle area to avoid both movable joints and immovable joints, in this case muscle, to be perfectly wrapped. Okay, the last step of the RISE model is the elevation phase, which require play athletes or patient of the calf injury to raise the affected area, to raise their leg or the injured area to a higher elevation. For instance, raising the full extended knee on a bigger pillow. Okay, anti-inflammatory and synthetic medication substances are proven to be the most effective to reduce the pain and swelling with adequate amount of usage, whereas herbal alternative also can be used to boost general health. Okay, next is the chiropractic massages. Can also promote a good avenue to improve blood circulation, aligning nerve in the nervous system externally, and avoid muscle spasm using analgesic cream and pain relieving oil. Professional leg rubs or stroking technique by club finance physiotherapists are always a stark reminder of how vital the process of conditioning to an athlete. Okay. Next, moving on to prevention. The prevention, we can use the modern or the new modern and the cutting edge kinesiology tape or the ionized and magnetized health bangles. Okay. As prevention is better than cure, what can we do as a member of the said society or a sports organization is to prepare and nurture the players so that they always feel at ease, as recovery needs patience, and patience is a virtue in the context we're discussing now. Okay, proper training schedule are needed promptly. So do periodical diagnostic tests to measure the personal progress of players' general ability, their body's tendency to respond to any kind of recuperation of past injury in the form of aggravated or exerted effort to rush to rush their players into action. Hence, it is an uphill battle for the rest of the backroom staff that comprises of backroom coaches and conditioning coaches, tactical coaches, to offer the best in-house medical service to the players within the facility of the club. Okay, the usage of kinesiology tape could also be introduced to promote overall well-being to players' general health and help to faster the recovery time to affected area. Okay. Okay, I think that's all. Thank you.
And that is all for our group for sports injuries in football. Thank you, sir, and our fellow fans. And that is all. Thank you.